Hello and welcome to Advanced Urogenital Manipulation in Osteopathy courses. My name is Nathalie Lejeune and I am a French osteopath with now more than 25 years of experience in men and women urogenital disorders. The purpose of these courses is to share with you my long experience in that field and to give you practical approach, guidelines in urogenital diagnosis and treatment in osteopathy. For instance, what is premenstrual syndrome and what can osteopathy do? How to help a man with a prostate adenoma? What should be checked and treated in postpartum? Where to start with stress incontinence? Patient after patient, I progressed in my research and personal studies to bring solution to sometimes very distressed patients, often left without any other option than to live with chronic pain, urinary disorders, dyspareunia, or unexplained infertility. It is this experience that I would like to share with you today. Keep in mind that sometimes patients don't complain about incontinence, for instance, because they have unfortunately learned to live with it. But they may complain about chronic hip, knee or lower back pain, and this is where urogenital training can make all the difference in the diagnosis, as you will discover. Understanding the functioning of the urogenital system will broaden your expertise in osteopathy in the best interest of your patient. As osteopath, we have obligation to restore the normal functioning of the various systems of the body by using the adequate treatment. This implies that we have the required knowledge to make an accurate diagnosis. We already have many tools in our bag, but the urogenital system needs a different approach, mainly by the use of the listening and induction techniques developed by Jean-Pierre Barral. Need to be assessed before performing any urogenital manipulation. For instance, a congested liver would always have an impact on the venous drainage of the pelvis by slowing down the flow of the vena cava, which can lead to pelvic pain and congestion. And a congested pelvis always leads to hormonal imbalance. A kidney ptosis will affect the left renal pedicle blood circulation. It therefore has an impact on the drainage of the left gonadal vein and on the proper functioning of the pelvic organs that depend on it. The links with the lower limb and the spine shouldn't be underestimated. A simple ankle sprain, a hip issue can affect the bladder continence by the continuity of the fascia and the muscular chains, as we will see. Restriction of mobility between T11 and L2 may also have an impact on bladder innervation, and conversely, bladder dysfunction would impact on the mobility of these vertebrae. Only the body knows, say Andrew Taylor Still, and the urogenital system must be carefully understood and investigated before any manipulation or attempt of treatment. We do not treat symptoms, but causes that we have to determine thoroughly and not only assume. Therefore, a strong knowledge in anatomy and physiology is the only way to understand, master, and treat in an effective way the urogenital system.